Hi, I'm Allie Cook for the Dental News Network. Today is September 5th, 2012, and this is your Wednesday Watch. Here are today's top stories brought to you by Johnson & Johnson Listerine. Last week, we heard a little bit from Dr. Glenn Van Az about his article in the new issue of Dentistry Today. I know you've been waiting to hear more, so here he is. Take it away, Dr. Van Az.
Thanks, Allie. In this month's edition of Dentistry Today, I released an article that discusses using lasers to remove veneers. There are many clinicians out there who say lasers are simply an application looking for a purpose. And the beginning of the article discusses how diode lasers routinely used for soft tissue removal are now being used for things such as venous lake removal or being used to treat soft tissue around dental implants. We move from that to the second part of the article, which specifically discusses how hard tissue erbium wavelengths can be used to remove veneers, often in under a minute. These can be a life-saving thing that can save your practice on difficult cases when you have to remove these veneers for whatever circumstances. The article itself discusses how it is done, the etiology of how it and why it can be done, and finally 3 clinical cases that will show you how veneers and porcelain restorations can be removed and can be a life-saving thing. There will be video links on there as well that will allow you to see in real time how those veneers can be removed. So check it out. I think you'll enjoy it.
Thanks, Dr. Van Az. Now here is yet another reason to keep up with your oral health. A study out of the University of California has found a link between good oral health and less incidence of dementia in senior citizens. More than 5,000 elderly people were observed during an 18-year period. Participants who reported brushing their teeth less than once a day were up to 65% more likely to develop dementia than those who brushed daily. The effect was more pronounced in women than in men. Researchers say that although this link has been discovered, it does not necessarily mean that bad health will lead to the development of dementia. Coming up, products and procedures, but first, here is a message from our sponsor.
Yep, that's your mouth, and it's surprising what it goes through in the course of a day. But what's even more surprising is that brushing alone isn't enough to keep it clean. Fortunately, you've got Listerine. Unlike brushing, which misses 75% of your mouth, Listerine cleans virtually your entire mouth. So what are you waiting for? It's time to take your mouth to a whole new level of health. Listerine, power to your mouth.
And now, products and procedures. Controlled release capsules may be a new way to treat periodontal disease. This new technology involves filling capsules with a protein to be injected into periodontal pockets. When they dissolve, the protein helps reduce inflammation and helps fight the disease process. Researchers say it could even assist gum tissue to regrow. The study was completed on mice and disease symptoms were dramatically reduced. This treatment could potentially rebalance the immune system in addition to helping regrow lost gum and bone tissue in the human mouth. Now, I'd like to share with you a recent interview I had the pleasure of doing with Cheryl Burke at Johnson & Johnson Oral Care.
Hi, Allie. Thank you for being here today at Johnson & Johnson Oral Care. We're so excited to have you to take you on an exclusive behind-the-scenes tour of our dental health laboratory. My name's Cheryl Burke, and I'm our National Director of Professional Marketing and Sales for Johnson & Johnson Oral Care. We're so excited about this campaign that's uniquely differentiated, and we're going to share with you a highlight reel, and then we'll come back and talk more specifically about the 4 dimensions of care.
You are a healthcare professional. Whether a dentist or a dental hygienist, an educator or a student, you've made a commitment to patients. This means when they arrive at your office, you sit them down and you spend quality time with each one, examining, healing, teaching, reminding, and praising them. All in the name of encouraging them to develop healthier habits at home so they can keep their mouths healthy and remain healthy between visits. You get to know your patients, and they get to know you. You share stories about your lives, your families, your hopes and dreams. That's what makes what you do so unique. You truly care about their well-being when they're both in and out of your office, because you don't just treat your patients, you partner with them, helping them develop a lifetime of healthy decisions, healthy behaviors, and healthy attitudes. That's why you pursued this career, this calling, in the first place, because your heart is at the intersection of health and caring. We understand. That's why every product we bring you is built on the dimensions of your care. Scientific care, the depth and breadth of science that supports superior products. Effective care, superior results that extend your excellent care to home care. Supportive care, plans and programs to build stronger patient partnerships. And customized care, specialized products to help you meet individual patients' needs. The care you provide is unique, and Listerine and Reach brands understand. That's why we share your view about your patients, because we know it's not just oral care, it's health caring.
And so what we recognize at Johnson & Johnson Oral Health is the need to provide specific solutions to meet specific patient needs. And what you see with our entire line of Listerine products, for example, is depending on your need, there's a product for you. So really Listerine is essential for every patient.
Thanks, Cheryl. Stay tuned next week because I'll be bringing you exclusive footage from my tour at Listerine. You won't want to miss it. Thanks for checking out the Wednesday Watch. We'll see you next week with more from Dentistry Today and DNN.